All right. Hello, everyone. Welcome, welcome, welcome. I know we were starting just a hair later than expected, but we are here. We are excited to talk to you about the things on today. Now, what I want for you guys to do is if you are interested in a natural remedy, you guys have been telling me this for a while. Listen, I don't want to take medicine. Okay, well, I found somebody who said you may not have to take medicine. I have you guys say, I don't want to do surgery. Okay, well, I have someone here who says you may not have to do surgery. Or if you had surgery and it caused some problems, then I still may be able to help you. So I want for you to keep watching because we have some great information. The other thing I want you to do, tell a friend, tell them, come on, because she's going to talk about the things today, the things that some people don't want to talk about. What we are talking about and what we're discussing is issues with pain, pooping, and peeing. Now, you guys know that people, you don't want to talk about it, but you are having issues with it. And what I'm talking about is like incontinence. And incontinence is basically you are having accidents, you pee on yourself, and it's no fault of your own. You may cough or you may sneeze, and you're having that issue. When I'm talking about pooping, I'm talking about constipation. You having issues with that. The other thing is pain, sciatic nerve pain, pain with sex, pain after you had children, all of those types of things. If you are experiencing it or you know someone else who is experiencing it, tell them, come on, girl, come on, sir, because this is for men and women. I have my expert here today who is very excited to talk to us about it. And we're just going to go ahead and get into it. So, this is Lessons Beyond the Stethoscope, where we provide practical health tips and tools that you can use in your everyday life. Because what we understand is life affects your health. And this is, if you don't know who I am Dr. Ashley Booth. I'm a board certified family medicine physician, and I am your host today. This is episode 15, Peeing, Pooping, and Pain, the benefits of pelvic floor therapy. And today we have joining us is Dr. Janelle Brown. She is PT, DPT, and I'm going to explain to you what that is. Dr. Brown is the owner of Ocean Health and Wellness. It's located in Savannah, Georgia. It is a pelvic floor physical therapy practice, and it provides mobile, which means that she comes to you, or virtual services. Dr. Brown has a doctorate degree in physical therapy from Florida A&M. So FAMU, our Rattlers, come on, y'all. All right. And she treats a wide variety of things from male and female pelvic floor issues, health and wellness, and also some sexual wellness for her clients. And outside of all of that and treating her patients, she also is a foodie and she loves to cook and fish. So thank you so much, Dr. Brown, for joining us on today.
Thank you for having me.
You're welcome. Now, listen, you guys are probably wondering, like, what the heck is pelvic floor therapy? What is a pelvic floor? I knew what a pelvic floor was, but the actual therapy side of it, I wasn't quite familiar with it. So you are in good company. There is no judgment here. And I always like to start off with, like, what are we talking about? Let's just get into that and explain that. So, Dr. Brown, can you explain to us what exactly is the pelvic floor, and then move into kind of like what is its purpose, like what does it do for us?
So the pelvic floor is literally the floor of the pelvis. So it's kind of like a hammock at the bottom of the pelvis where the muscles are located. And they provide functions like support for our organs, our bladder, rectum, uterus. They provide support for continence, keeping us continent. They help with pleasure, sexual function. They have many functions, but it's literally the floor of the pelvis.
And knowing that it is, I like that it's like a hammock,
Hammock.
and then that you're having the support, so it's supporting all of these structures that you just mentioned. So that's why we're having like all of these issues. What exactly is pelvic floor therapy?
Mhm. So, pelvic floor physical therapy is basically physical therapy for the pelvic floor. We work with dysfunctions of the pelvic floor, which can include anything from bladder, urinary issues, bowel issues, problems with intercourse, pregnancy, prenatal, postpartum, anything that deals with your pelvic floor. So it can be pain, it can be discomfort, it can be weakness, or it can be reducing tone in your pelvic floor. So it's aimed at the muscular function, and it's a lot of preventative measures as well, things that we do to prevent things from worsening. So we are physical therapists first that specialize in pelvic floor. So we're musculoskeletal experts.
This is the thing, because I know people give the eye roll sometimes when we mention physical therapy, because I'll tell patients, you should see physical therapy for this. And they're like, and what you're telling me though is that physical therapy, you are a physical therapist first, and then you specialize even more in those muscles that are in the pelvic floor. Well, I'm telling you guys, hold the line. Don't hang up on us yet, because there are some wonderful benefits. And I have seen some of her patients know the things that they were experiencing beforehand, and have seen how she has truly transformed and changed it. And again, without medicines and without surgery. So the title of the show is Peeing, Pooping, and Pain. So let's just jump into the peeing part of it. People, like I said earlier, you have the incontinence, you may have an accident on yourself, you sneeze, you cough, and then like, oh my gosh, like, I have to wear a pad all the time. I'm hearing that. The other thing is like urgency. If my body tells me I have to go pee right now, I need to go right now, or I'm going to have an accident. So walk me through some of the things that first could cause those symptoms that people are having, and then what you do to try to help people to treat it.
So, like you said, there's different types of urgency. Different types of incontinence. There's urge incontinence, where when that urge comes in to urinate, you can't hold it. You will urinate on yourself. There's stress incontinence, when a force is introduced or a stress to the pelvic floor, like a sneeze, a cough, a lift, getting out of bed, getting out of the car. You leak with things like that. Then you have functional incontinence, where the reason that you leak on yourself is because you have something that's affecting you from getting to the restroom, whether it's a painful leg, maybe a prosthesis, your mobility isn't as good. So there's, different causes for these many different types of incontinence. It can be from weakness of those muscles. Now those muscles may be too tight, which is causing it to be too weak. A lot of times after birth, there could be a trauma to those muscles where they're not functioning as they should. It can be from things you do in your daily life. What are you drinking? What are you eating? Things that are irritants to the bladder that make it hard for you to be continent because your bladder is trying to spit it out. So it's many different causes for that. Sometimes it can be caused by some type of neural issue. So if you've had a surgery or injury and a nerve was damaged, that can affect your ability to remain continent. So there's many different causes.
And one of the things, before we go into treatment, I know that you did this very cool thing on your Instagram where you talked about, like, when you talked about what you're eating or what you're doing. One
Mhm.
of the things is, I was telling people, and I know that what people tell me is like, well, I have to go pee a lot. So I'm just not going to drink a lot. I'm just not going to drink that much water, because if I don't drink the water, then that
Mhm.
means I won't pee. But talk to us about how that really isn't the best thing to do, because of what it does on the body.
Yes. So, and when you think about it, you think it makes sense. I drink more water, I pee more. I don't drink enough water, I won't pee more. So, like, you feel like you got it all figured out. But what happens is when you don't drink enough water, that causes your urine to be concentrated. And what concentrated means is there's probably more bacteria in the urine. And when it's sitting in the bladder, imagine holding like a mouthful of hot chili peppers, right? You're going to want to spit it out immediately. It's going to be irritating. It's going to be burning. It's not going to feel good. And that's how concentrated urine is to your bladder. So when you're drinking your juice and your tea and your sodas and your seltzers and your energy drinks, and you have no water to kind of dilute that solution, that leads to that concentrated urine. So you have concentrated urine in your bladder. Now your bladder is very irritated. It's going to want to spit it out. So you're going to have leaks here and there because your bladder is just not holding it as it should, because it's so irritating. And how do you know you have concentrated urine? Your urine could be a darker yellow, have really yellow tint to it, or it can have somewhat of an odor to it. And you'll just always have to feel like you have to go, even though you just urinated. You might go to the bathroom, not a lot may come out because your bladder is is going off. It's telling you like, I feel like I have to go, but that's just that concentrated urine irritating it.
I absolutely love when you give that example, and I'm so glad that you shared it today
Mhm.
because I never really thought about it that way. And then when you said, I was like, oh, that makes so much sense. It just like it's like brilliant because a lot of it's brilliant. I'm just gonna leave it there because your explanation was
Thank
awesome on it. So tell me, how do you help people who have different types of incontinence, like a stress versus an urge? Like, what is it that you kind of teach them or help them do?
So first, at our evaluation, we determine what type of incontinence you're having. So we have that determined, and then we determine what is causing this to occur. So if you're having stress incontinence, are you having stress incontinence because maybe the muscles aren't coordinated and the timing is off? So like when you have a sneeze, you should have those muscles bracing themselves, kind of contracting to hold the urine in. Are you having issues with coordination? Are those muscles too tight to where, can I show a demo here?
Absolutely.
So are those muscles too tight to where if you see the muscles here, right? This is the urethra at the top, and you see muscles here that are surrounding it. Those muscles help keep you continent. So if those muscles are too tight, they're at a shortened length, they can't function properly. They need to be at their optimal length. And this is why I know we'll probably talk about this later. Kegels can make your pelvic floor too tight. Those muscles won't be able to function properly to keep you continent. It can be due to other things, weakness. Maybe those muscles have reduced tone. So once we figure out what that cause is, we start our treatment. So if I have a patient who has too much tone and those muscles can't function properly, we're going to work on down training, reducing tone, whether that be some like myofascial release to those muscles. We're going to work on just tension holding in the body, find out what are triggers for them to hold the tension. Go through a lot of down training their nervous system, stretching, breathing techniques, just really connecting with the pelvic floor. And for my urgency incontinence patients, we go through a lot of urge techniques. And it's a lot of what you wouldn't think. Like you probably think urge techniques is me showing you how to squeeze more to hold in urine. It's the exact opposite. It's me teaching my patients that when that urge comes in, you have to relax. So we go through that. So it's a lot of different things. Honestly, I have like a whole bag of tricks we as pelvic floor PTs do. So it's never just one thing. So it's a lot that we can do.
So it sounds like it's individualized. So first you have to figure out what is actually causing each person's particular issue, and then you kind of tailor it to that person. But there are some different techniques that you will use. And it looks like one of the things what I'm hearing is it's kind of like relaxing yourself. It's all about getting in tune with your body, controlling your body, understanding what's happening and trying to retrain what's going on with it, but then you also assist and help them figure out how to retrain.
Yes,
When
bladder
we
is a big part. And I always tell my patients, you are in control of your bladder. Do not let your bladder run you. And then, we teach them how to be in control of their bladder.
And then the other thing is, because it's all connected, it's all in that same area, the pooping side of things. And I didn't really understand because I knew with pelvic floor that, especially with therapy, that it can help with the urinary incontinence, but you also have what we call incontinence where you can pass some stool. And you also can have the other where you don't want to pass the stool and you're constipated and you're having to take a laxative all the time to help you go. I have a few people who said that, oh, I haven't been able to have a bowel movement. I have to keep doing this. How do you approach that? What could be causing that and going on with those issues?
So honestly, constipation is one of my favorite things to treat. I just love like a patient comes in, they're like, I poop every 10 days. And then now, like towards the end of the treatment, like they're regular twice a day, like they love being regular. I just love a good constipation patient. But so I'm sorry, did you ask me the causes of constipation? I got so excited. I'm sorry.
No, it's sure, it's okay. Yeah, if you want to, you can discuss the causes of it and then how you help your patients achieve being regular.
Mhm. So, a lot of different causes. Like I said, pelvic PT is so individualized. Everybody has different causes for different things. So, constipation can be due to your diet. First of all, what are you eating? What are you drinking? That can be slowing down the stool transit in the colon, and then also could be due to coordination. Like I said, you might feel like you're pushing with all your might and just you're hitting a wall, nothing's coming out.
Mhm.
In actuality, you might be squeezing. You'll be surprised how when we do our evaluation, our pelvic exam, and I tell a patient to bear down as if you're having a bowel movement, and they squeeze instead. So imagine when you think you're pushing so hard and your muscles are actually going the opposite way. So coordination issues, and many different other things. Some patients aren't active enough. Medication's a big one. There are a lot of side effects for constipation from certain medications. So once again at the evaluation, we figure out what that reason is. We start kind of like peeling at layers. It's like an onion. So first, let's get this down pat. Okay, good. Let's get this down pat. And then you see the progression over time. So if I feel like it's possibility, it's a constipation due to a diet issue, we work through their diet. We go through liquid, food, literally working on their diet. If it's something with coordination, we work on coordination training for those muscles. Or if those muscles are too toned, again, same thing like with the incontinence, we work on down training those muscles, reducing the tone of those muscles. Because you can imagine if your pelvic floor is like this, nothing's getting through there. The stool you can push
Mhm.
all day, it's like you're hitting a block. So we work on reducing the tone in those muscles so they can relax and the stool can pass through comfortably.
That I like that demonstration of showing how it actually is like really tight in the tone and then
Mhm,
how it's preventing it from going through. Guys,
mhm,
if you are just tuning in, again, today we were talking about peeing, pooping, and pain. These are things that a lot of people are having issues with through no fault of their own. It could be, like she said, this could be a medication issue. It could have happened after surgery, after a trauma, any of those, but she is offering. I have Dr. Janelle Brown, who is a pelvic floor therapist, and she is talking about a non surgical, non medication way to address it. And the other one is pain. And there's a lot of different types of pain. You have the sciatic nerve pain, you have those different like pelvic pain that come from like when people have a pregnancy or something like that. The first one I want to touch on is like the sciatic nerve pain.
mhm.
What is going on with that? What exactly is sciatic nerve pain? People come to me all the time and it's like, my sciatic is acting up. And depending on what's going on, like, that's not actually it. So, can you tell us what is sciatic nerve pain? How does it present? And then how you are able to help people get some relief?
So sciatica is basically the sciatic pain of the sciatic nerve. So this your sciatic nerve starts from the bottom of your spine. It comes out of the nerve root and it goes down your glutes to the back of your leg, branches out into two other nerves down to your foot. So sometimes that nerve can get pinched, right? So it can be pinched by a herniated disc. It can be pinched by like a bony growth, a bone spur, or it can be pinched by a muscle. Maybe you strained a muscle or a muscle is inflamed and it's just pressing on that nerve. So wherever the pinch is occurring at, below that, that's where you're experiencing your symptoms. So let's say you have a herniated L5 disc, then everything below L5, you'll have some of those symptoms. Those symptoms include pain, numbness, tingling, burning, throbbing, just a lot of discomfort. Symptoms may be worse when you're sitting because when you're sitting, if you think about it, your hips are bent, your knees are bent. That's more tension on that muscle. So you can experience that in the back of the leg to the foot, the front of the thigh, the sides of the thigh, the inside of the thigh. You can experience some of those symptoms there.
Okay. And when people, I know a lot of people, when they come to it, it can be very debilitating. Like
Mm,
sciatica is a true issue. People are medication for it,
mhm,
considered surgery, like all these different interventions that are happening. How do you approach it and help your clients or patients get relief?
mhm. Well, yes, I agree. It's very debilitating. I've seen some patients come tears rolling down their eyes. They can barely walk. Their quality of life is completely messed up. So it can be a very painful thing. So what I usually like to do is again determine what the cause of the sciatica is. So as physical therapists, we are taught different diagnostic factors. We do different types of tests, and these are us testing the muscles, musculoskeletal system, not test like technology or anything like that. So once we perform some of those tests, we determine, okay, what's causing the pinching. So if it's something herniated disc wise, we have certain modalities and certain exercises that we do to reduce the compression from the herniated disc. If it's something muscular, we're working on, I like to say lengthen before strengthen. So if it's because a muscle is too toned, tight, or inflamed and pinching on that nerve, we want to work on reducing that tension. Basically, your muscle's angry and we want to calm it down. So, again, modalities, stretching, different things like that. Once we've kind of reduced some of the tension of that muscle, we want to work on strengthening that muscle because a tight muscle can be a weak muscle. Once we work on strengthening that muscle, it can start functioning properly to where it won't aggravate the sciatic nerve. So we go through things like that. And of course, like I said, it's progression. You see the progress over time. And I've had patients come in, especially pregnant women. This happens a lot. My pregnant patients come in, they can't walk, they're in so much pain, and then they're out living their lives. So I'm not an advocate for the medication because at some point we want to fix the issue. We just don't want to band aid it.
The is the thing that you're telling me about too. I know the pregnant patients, and these are some of the people that you really do specialize in. They
Mhm.
are experiencing the sciatic nerve pain, but they're also experiencing some other issues in the pelvis. Then after they have the baby, they're having some pain and issues with the pelvis. There could be pain with intercourse afterwards. All of these different things. I know people who have hysterectomies and things are starting to change and shift, and they notice a change, especially with intercourse and stuff like that. And this is another area that you really like to focus on and you enjoy taking care of. Talk to me about some of those issues, those other areas of pelvic pain, and how you
Mhm.
address it.
Well, the thing that's hard, like for us as public PTs and just PTs in general, is that like your doctor or who you go to first, your first line of treatment may tell you that it's normal or it's common. But pain is never normal. It may be common, but it's not normal. So that's the first thing, like being an advocate for yourself, knowing like, okay, this doesn't feel right. And you may be offered medication, you may be offered surgery, but you want to get that first line before you do something kind of drastic like that. So my pregnancy patients, they have a lot of pelvic pain, that lightning crotch, pubic symphysis pain, sciatica and back pain. Your body's growing, it's expanding. It might be impinging on certain things, your lungs, your pelvis, your back, your nerves. So there will be some dysfunctions there, but there are things that we can address. And I love when my pregnancy patients come see me early because you're going to get bigger, but we're going to we're going to ride this pregnancy out. We're going to address things as they pop up so you can have a pain-free pregnancy and enjoy being pregnant. So the pelvic pain can be very debilitating. Some things it could be due to instability. When we are pregnant, our body releases a hormone called relaxin, and relaxin comes in, it loosens some of the ligaments and things like that, so you can prepare to push this little human out. And sometimes relaxing does its job too good, and we get some instability right in the front of the pelvis, that pelvic bone. So we want to work on stabilizing that as much as we can throughout the pregnancy. Again, it could be due to some muscles are under stress. Those muscles get really short and tight when they're trying to hold you up with all that weight. So we work on reducing some of the tone of those muscles. Again, strengthening, work on breathing techniques. It's hard to breathe when you're pregnant, and sometimes that can cause pain in certain areas. You need that expansion of those muscles in the abdomen and the back. So we work on a lot of different things. But pelvic pain, sciatica when you're pregnant is not normal, but it is common. If you are feeling this or you know someone who is feeling this and they're being told by their OB that it's okay, it'll pass, then seek the help of a pelvic PT.
The the one thing that I'm hearing from you as well is that these are different types of exercises. But some people will say, well, I'll just Google it.
Mhm,
Google is our friend. And I
mhm,
can Google the exercises that I need to do. But what
mhm,
I'm going to do is caution people. I'm going to caution you about doing that because one of the things is Kegels, Kegels, you know what I'm trying to say. That exercise, everybody was like, I just need to do those and I'm going to be fine. And that is going to help me. Talk to me about how that actually could make things worse for people.
Mhm. So yeah, as soon as you hear pelvic floor, pelvic PT, anything pelvis, you're gonna think Kegels. And I have some patients that come in, they're like, my Kegel's good, I'm good. I'm like, okay, well, that might be the problem. So Kegels is not everything, and even a lot of physicians, I get a lot of patients who are like, my physician told me to do Kegels or vaginal weights, but nothing has changed. So a lot of times, if you've been hearing what I've been saying, the dysfunctions are due to increased tone in the pelvic floor. If you think about it, if you ever have like maybe a crick in your neck or like a really like a knot in your neck, it doesn't feel good. You try to turn your neck, it's restricted. It's really hard to move. Well, your pelvic floor muscles are the same way. They can get knots in them. They can become restricted, and they can cause the issues like the incontinence, the constipation, the pain with intercourse, because all of those things, um, to pass stool, to have intercourse, insertion, those things require muscles to expand and they need to be relaxed to expand comfortably without pain. So, what Kegel is, it's a muscle contraction. You're contracting your pelvic floor, you're relaxing, you're contracting your pelvic floor. Imagine doing a bicep curl, boom, several times a day. Your bicep's gonna be fatigued, it's gonna be tired, it's gonna feel a little weak, it might get a little tight. So that's basically what you're doing with the pelvic floor. It's a muscle contraction, and you don't want to overdo it because then that leads to other issues. So if you have a provider who's telling you just do Kegels and you'll be good, that's not really the best thing. You need to be evaluated because, first of all, we need to know why this is occurring. Now, if patients have prolapse, to where one of the organs are descending down into the vagina, that's something else where I may prescribe Kegels because now we want to work on those support structures and pulling things up. So it really depends. I'm not saying Kegels are, terrible and never do them, but it just has to be the right situation.
Got it. So we just, again, it's individualized and it has to make sense for you and which one makes sense for you. If you guys have any questions, be sure to chime in because this is what this is all about for us to try to answer what is going on. One of the things that I know someone had asked me about was when they are doing these pelvic exercises or therapy, it seems like it could be an intimate thing. And someone was like, well, do I have to get naked? Like that was exactly how they
Yes.
phrased it for me. And I was like, no, I don't, and I was like, I know that she's able to still kind of, I think what happens is she just kind of positions you and shows you a few things, but they are concerned about just how intimate is
Mhm.
this going to be and what exactly happens during that a therapy session. So can you just give me a brief, like are everyone fully clothed and how do you approach a client when you're trying to help them with the different exercises or things like that?
Of course, I'm so happy you asked this question because I feel like people hear pelvic PT and they get nervous and they just, don't want to seek the help. But first, at all my evaluations, I do nothing internal. I want to get to know you, want them to get to know me before we even take that road. I don't have to do any internal work to help you. That's why I have virtual patients that do get better. I've never seen them in person. I've never laid hands on them, but they're getting better and their problems being eliminated. So it does not have to be internal. You don't have to get naked. Now, if we are in person, I would like to, it would be better if I'm able to assess the pelvic floor. What does that involve? That involves you just undressing from the waist down. You're covered in the sheet. We don't use speculums, stirrups, anything like that. It's just a digital exam, a gloved and lubricated finger, and all we're doing is we're finding the specific muscles in the vagina or the rectum, and we're seeing the tone of those muscles. We're seeing if we feel anything significant. Is there any irritation down there? We're testing the strength of those muscles, so we can better evaluate and see what our treatment plan can be. That does not have to happen. When you work with so many patients and when you're specialized in pelvic floor, you know why certain things occur. You get to notice certain patient presentations. Okay, this person has stress incontinence. I know it could be this, this, or this. So let me ask some more questions. Let me find out what it is. We don't have to do anything internal. I have patients who aren't comfortable with that. We don't do that. But there's so many other things that can be addressed that can help you, that doing internal work isn't necessary. For my men, some men don't want to do a rectal exam and they don't have to. I have about two male clients right now that I've never done internal work on, but their incontinence has gotten so much better. So no, You don't have to get naked. It's to your comfort level. There are certain cases where I could recommend, like, hey, I think it'd be good if we did some kind of muscle releases, some internal muscle releases today. What do you think about that? Yes, no. Okay, that's fine. We can still help you. You can still get better.
Perfect. Thank you so much for answering that question because people want to know, like, how exactly do you approach that? I appreciate all of this information that you have provided on today. It's been very valuable. It's very helpful, and it helps to
You
address, I know, what a lot of people have been experiencing. On top of all of what you have talked about, do you have any other comments or tips that you would like to add?
I'm going to just say to all of my women who are pregnant, postpartum, or planning to get pregnant, get a pelvic PT on your team, even if it's not me. Have a doula. I do also provide doula services. You need to have that advocate there, and just everybody in general. If you're being introduced surgery or medication, ask for other options. Ask about pelvic floor therapy. Tell your friend to tell a friend. I get too many patients who have had surgery or been on medication before they've come to see me, and their problem has gotten so much worse. So advocate for yourself. Make sure you understand why things are being done. If they're recommending a certain procedure, ask them why. Why are you doing this? What will happen afterwards? How will this help me? Know what's going on. Just because someone has a doctor in front of their name, or they're in a clinic, or they're in a white coat, that doesn't mean anything. You need to know what's happening to you and why it's happening to you. There are a lot of unnecessary hysterectomies. There are a lot of unnecessary surgeries that don't have to happen. So be your number one advocate. Be an advocate for someone else and ask questions, and you don't have to take the first answer.
It's one of the things is, guys, Dr. Brown and I did not talk about this, but as you can see, she is on the same page with me about advocacy. A lot of the guests that I have on, I don't talk to them about that piece, but
Mhm.
they understand the importance of advocacy, which means that you have to take control of your health, means you have to start asking the questions, you have to see what's happening. And that, especially when someone's doing surgery, I always tell patients, listen, ask them what to expect afterwards. What am I going to experience? How's my life going to change? What are some of the risks and that could happen? That way you can be prepared and you can have an informed decision. You can make an informed decision and then decide, okay, well, am I going to try something else first? But understand that when you do the physical therapy, you have to be all in. This is
Yeah.
something where you absolutely have to be a participant and say, I am going to do the work. You have to be willing to say, okay, I'm going to do these exercises like she said. I'm going to drink the water or do this or do that so that you can truly see the change. And I know that you are seeing the changes in your patients at
Mhm.
Ocean Health and Wellness. So talk to us about your clinic.
Yes. So I am a mobile and virtual practice, meaning I either go to my patients or I treat my patients virtually over the computer. I have some patients who aren't in Savannah or they aren't in the state of Georgia, so I treat them via telehealth. Or I have patients in the area, Savannah, surrounding areas, Bluffton, that I go to. I have all my equipment, I have my table. All we need is a private room where we do our sessions and our treatments. So like we just talked about, is pelvic floor PT, bladder, bowel, pain, and of course, first, I am a physical therapist, so I work with things like knees, shoulders, necks, backs, things like that. Um, I do all my consultations are free. The first consultation is no charge to you. We get to know each other, talk about what's going on, and I really tell you if I can help you, because I won't take on a case that I don't feel like I can help you with. So I recently started up at the end of last year. Still building clientele. Things are going great though. I'm loving it. All my patients are getting better, and I'm getting to meet some amazing people like Dr. Booth. So yes, this is my practice, Oshun Health and Wellness.
Yes, awesome. And tell them where they can find you and find more information about what you do.
Yes, so you can find me. Instagram is at Oshun Wellness. My website is www.oshunwellness.com. You can also email me at info@oshunwellness.com. Is there a place I can write this, like a chat or something?
You can, and I'll also provide it for them in the chat. and I will send out the additional links so that they'll have your information, because I want for people to be well. So,
Yes.
like she said, she has a website, she has Instagram. You can also email her. I will get all of that information out to you guys so that you can see her. If you're
And
having any of these issues, like she said, she does a free consultation and she will be honest. I can help you, or I may not be able to help you. So you don't lose anything, but you
no,
get a chance to find out again what your options are and what you're going to be able to do. So thank you again so much, Dr. Brown, for joining us on today.
yes, ma'am. Thank you so much for having me. Also on the Instagram or the Facebook, you can just click book now. It'll take you to the site. You can book your consultation 123, very easy. I love being here. Thank you for having me. I love all things pelvic PT. This is my passion. And just thank you again.
You're very welcome, guys. Well, this is all that we have for today. If you enjoyed today and your friend wasn't able to get on, go ahead and share with them. Say, girl, you missed it, or sir, you missed it, or, put it out there so people will know. Subscribe so that you don't miss any other content, because my job here is to provide you with the information that you absolutely can use in your everyday life. So until next time, we will see you later. Take care.